Now what happens? As soon as the trauma happens, there is an injury to the brain tissue, which is generally neuron and other glial cells, and lots of chemicals which are known as neurotransmitters which are released. We know that these cells have some mechanism where sodium, potassium, calcium goes inside, outside, and there are lots of these ion channels, and they are very important for the integrity of a functioning cell. All those things are mediated via various receptors where these neurotransmitters act. So as a result of trauma, there is a lot of potassium leaving the cell and a lot of calcium entering the cell. Once these things happen, when the calcium comes into the cell, calcium is very, very toxic. And also, due to the chain of chemicals, most of them are known as free radicals, which is probably a final pathway of damage to cells in various organs of the body. They cause damage to various vital structures inside the cell. So this calcium basically causes all kind of damages to the cell, and the cell which had a potential of being all right now is going to be a dead cell. So can we prevent it is where the scope of this talk. Because these channels have to work, they are like pumping sets in your house, and if the pumping set has to work, it has to use electricity. So instead of electricity going for something good in the brain, now this electricity is being consumed for maintaining the sodium, potassium and calcium balance in the cell, apart from multitude of others. So a lot of energy is being wasted in the brain to try to get some kind of equilibrium. So can we reduce that energy requirement? Remember, there are two parts of injury in the brain. One, the damage has occurred, where nothing you can do about it. But the more important is the normal brain, which could live or which could die depending on your intervention, is what we are trying to concentrate on. So we are trying to concentrate on a secondary brain injury. The only source of energy in the brain is glucose. So we are going to consume glucose. For that, the blood has to carry glucose. So you require a reasonable amount of blood flow and reasonable amount of glucose in the brain. More is bad and less is very bad. We also know that most of the function will recover within 3 months, but of course it's very difficult to know whether some of those functions which are impaired have a secondary gain issue or not, and that is a separate topic of discussion.